I am Dr. Arush Sabharwal from Surgical Center for Obesity and Diabetes. This World Obesity Day, we at SCOD Clinics take the initiative to make this nation an obesity free nation. Obesity is defined as the overconsumption or the underutilization of the caloric substrate. WHO, the World Health Organization, has declared obesity as a global pandemic. It is a non communicable type of disease which is leading to so many other diseases. Name it cancers, like right from endometrial cancer to breast cancer to prostate cancer. All the cancers which are hormonal based cancers are due to obesity. There are so many other complications like PCOS, when women have irregular menstrual cycle, when they have hirsutism, is when they have hair, facial hair, male infertility, low sperm count, type 2 diabetes, hypertension, dyslipidemia, coronary artery disease. So many of these complications can lead from a simple treatable disease known as obesity. India is the global capital for diabesity. It has the highest number of obese diabetics. In fact, you will be shocked to hear that in in India, diabetes happens at a much lower BMI rate. So, hence, in fact, our Aussie guidelines clearly states that at a BMI of 27.5, if you have uncontrolled diabetes or any two of the comorbidities which are associated with obesity, you are a candidate for bariatric surgery. All the CGHS, Central Government Health Scheme, and all the other government schemes are following this CGHS guidelines, which clearly states that obesity should be treated well in time. This is IRDA guidelines. IRDA is a body which is the main body for all the insurances. This clearly states that obesity is and should be treated because it is the leading cause of many other diseases. Here, if you can, appreciate in this IRDA guidelines, it says obesity, weight control, expenses related to the surgical treatment of obesity that does not fulfill all the conditions below. So they are following a certain set of guidelines. These are the set of guidelines which they are following. We at SCOD are dedicated for making our nation an obesity free nation. It is the only super specialty clinic in the entire country that is doing the super specialty work of finishing obesity as a disease from this nation. Of course, we at our center, we are following all kinds of protocol because one shoe does not fit everybody. So we have nutrition, we have pharmacotherapy. Pharmacotherapy means semaglutide, Ozempic, all these kind of medications that we prescribe. Gastric balloons. There are two types of gastric balloons: SPATS 3 gastric balloon, which is a US FDA approved, and the Elurion gastric balloon, which is a swallow pill. This is what it is I'm getting famous for. Unfortunately, it is not US FDA approved, and we don't do it very often because we are creating an awareness in the society that Allurion balloon is not US FDA approved. So we should not be doing it, because any complication that happens, you will be responsible, we will not be responsible. And the final answer to the treatment of obesity is bariatric surgery. And we at Scott are focused towards the treatment of bariatric surgery as such. If you ever want, you can follow us on Instagram. Our Instagram handle is SCOD Clinic. Our Facebook page is SCODLLP. Or you could follow me, Dr. Arush Sabarwal, on YouTube. For any other query, you could contact us on our WhatsApp number 8130130489. And lastly, for anybody who's planning to have a treatment, this is a complete bariatric guide which we have launched and which is available. You can, in case if you guys want, you could just get in touch with us for the same. Thank you.